Welcome to another episode of Zealous Podcast. I'm your host, Rocky Snyder. This week, I've got Katie Lortie in the house. She is an athletic trainer with the Minnesota Twins organization. We're going to talk about common injury sites, her path into athletic training, different kind of things doing in the off season, and a whole bunch more. Be sure to follow us on Instagram at Rocky_Snyder. Click the subscribe button and enjoy the show. Katie, welcome to Zealous. I'm stoked to have you on, and we're going to talk all about the Minnesota Twins organization you're working for, but I want to hear your super heroine story, so to speak, your origin story. When did you get bit by the ATC bug and all that?
I got bit by that bug pretty young, I think. Most people, they go to college like, oh, I'm going to change my major 4 or 5 times. I decided when I was a junior in high school, we had AT classes that we had the option of taking. So I got to work as a student with the athletes there. I was a student in high school, athlete, so like it worked perfectly. And I kept that passion going till now. It never fell off. I never lost it. I just kind of kept adding pieces to it. So I ended up going to college as a soccer player. I played for a few years at Chico State. And then decided to hang up the boots and keep pursuing my career because that was probably the smart choice at the time. Soccer wasn't going to take me anywhere, and I knew AT was like that next passion. Kind of like you said, your daughter, like she could spend 10 to 12 hours, 15 hours on a field in the training room with the guys, with the girls, and it doesn't feel like a job. It feels like you're supposed to be there. So that's
cool. Okay, so then you're playing soccer in high school, probably multi-sport athlete, and I'm imagining something happened though. You didn't just walk into the athletic room unless you needed taping. Did you sustain an injury?
Yes, I was probably one of the most injury-prone athletes that has walked on the soccer field. So I lived in the AT room. My trainer hated me because I was also that stubborn athlete as well. That would come in and be like, oh, like, yeah, I have this, but like, I'm going to keep playing. And she's like, no. I'm like, but like, maybe like, so it's like, I was always that athlete that was able to like, like, yeah, I'm fine. Sure. Like, I'm going to keep playing through my injuries. So I think over the years, just like all the injuries, being in the training room, learning how my AT at the time in high school took care of us, it just really drew a passion for like the care of athletes, and like if the athlete builds that bond with you and stuff, how quickly they can actually get back to playing if they're not completely stubborn the entire time. But yeah, I mean, multi-sport athlete, was in the trainer room, lived there. That was my second home.
Completely makes sense. I can totally understand that because you're exposed to all that. And then you go to Chico. For those that don't know Chico, I went to UMass Amherst back in the 80s, which had a very similar reputation as Chico State. Not known for their high academics, more so for their high state of consciousness, shall we say, and parties. But I got to know, have you ever been to Kinder's Barbecue?
Yes, of course.
Oh, their ribeye steak sandwich to die for. Now, of course, Kinder's barbecue sauce is in every Costco and supermarket around that I know of. But oh my gosh, I will have that scene from, I think it was Fletch or Chevy Chase movie, whatever it was. It was like, I'll have a steak sandwich and a steak sandwich, right? That's when you go into Kinder's, you're like, oh my gosh, could I have 2 ribeye steak sandwiches, please? There's something amazing about it. But so you go to Chico State and you play a couple seasons on the soccer pitch. And then, but you don't land there. You went from an East Bay, California girl down to Southern California and ended up in San Diego State.
Total change of scenery. NorCal, SoCal, so different.
Oh my gosh, so different.
People from California will understand what I'm talking about.
Yep. San Diego is all about triangles. You never notice that? Like the roadways? It's like in order to go a straight line, you actually have to veer left and then take a right and then come back around. It's like, who the hell developed those roadways? Anyway, I'm getting off the subject here. San Diego State, what did you do there?
So transferred down there straight into their athletic training program. I was one of the last few classes that was able to get a bachelor's in athletic training. I think one class after me was like the final year because now everyone has to get a master's. So to be honest, I thought that was actually like a blessing because I was able to go get my master's, as we can talk about later, in sports psychology. But went down to San Diego State, absolutely loved it. Like, it was just a totally different vibe. I met some of my best mentors down there. I got exposed to all kinds of sports. Baseball was my first clinical rotation. Absolutely loved it. That mentor taught me basically my kind of base of my philosophy that I have now of how I do things. So it was incredible. And then I just went through the next couple of years through the program. I got different clinical rotations. I worked D1, I worked JUCO, which was really cool to kind of see the difference between like a D1 university versus a junior college and how they function, how they do things, how you have to take care of the athletes. They're very different. So having both those experiences was pretty awesome.
Yeah, okay. I got to admit, JUCO is the first time I've ever heard that term, but I knew what you meant right away. JUCO, cool. I'm going to use that from now on. San Diego State, yeah. I had this guy, Brandon Joyner, who is with the Dallas Mavericks. He's one of the strength coaches over there on a previous episode. We were talking about the master's, the requirement of having a master's degree in athletic training. And his take was that it's actually hasn't been very good for the field of athletic training, partly because it's not a high paying career. So to try and go and get a master's degree in a career that's not going to really be paying for it, it just doesn't, it's not a great return on your investment, so to speak. But you did something different. You switched into a master's in sports psychology. I'm curious how, with because you're an ATC, right? You're athletic trainer, but you also have your master's in sports psychology. How did you marry those? And is it a good marriage, or do they conflict? What's that like?
It's very interesting marriage, but I think I've been able to use the tools from both, like, in a very collaborative way, in a very successful way. There was a lot of experiences when I was a student where I had athletes dealing with either clinical psychological issues, or it had to do with their injuries or different types of things. There was addiction, there was depression there, and it was either stemming from personal or it was stemming from the injuries that they were going through, whether it was long-term, short-term situations in life, like they were only playing at a JUCO, right, when they wanted to be at a D1, right? So you're dealing with that factor as well. And it's in a like non-formal way that I kind of do it. So it's not like I'm like sit down and be like, tell me all your feelings. I take different bits and pieces and techniques of like goal setting or different ways of like talking to them, or like teaching them a different perspective on like how to look at a situation, like, and kind of just use it in like how I talk to them and how I build that relationship with my athletes. And like it over the time has like been able to help me develop such strong trust and relationships and bonds that like has made injuries and rehabs 10 times more successful, in my opinion.
I definitely want to talk more about that, but I would be remiss in not continuing the previous course of action here with our dialogue about San Diego State, junior colleges, and all that, D1. But then eventually you moved into where you find yourself now within the Twins organization. How did that come about?
It's actually kind of a long story. I'll try to keep it short.
We got time.
So when I graduated from my master's, it was COVID. So there was actually no athletic training jobs anywhere because sports were shut down. So I had a couple athletes from the previous year that I had worked with because I was one of the GA athletic trainers while I was getting my master's in sports psychology, that trained at these giant performance facilities down in South Florida, because there's a lot of them down here. And they're like, Katie, like, you'd be a great fit. Like, let me like reach out to like the people that own it. I was like, okay. And they got me hooked up, and I ended up working as a performance specialist. So not necessarily a strength and conditioning coach because I didn't have my CSCS, but I was a performance specialist because I had at least a bachelor's in some type of kinesiology, athletic training. I had a background in sports. So I ended up working there for a whole year, training NFL players, working with minor league baseball players, major league baseball players, basically understanding an entire off season because no sports had a season that year. So it was really, that's like a whole another interesting side of things, but I learned a lot that year that I can apply to athletic training as well.
Right on.
coming from like that strength and conditioning side of things. So that happened. I was like, oh, I miss the injuries. I miss the rehabs. It's the one thing I will say that's different with athletic training and S&C, in my opinion, is like the one-on-one like bond and personal relationships you get sometimes. The way we were training was more like group-based settings. So it was harder to really have that like one-on-one interaction. And I kind of missed that side, and like seeing guys return to play and seeing the look on their face when they're back to playing and healthy. And so I was like, okay, I got to go back into athletic training. So I actually ended up getting a job with the Astros for the first year back in baseball, kind of opened things up again and whatnot. And so I spent a year with them, and then I ended up with the Twins this last year. So that's kind of how I ended up where I am now. It was kind of a weird path. It wasn't very, straight athletic training. It kind of took me different routes, but I'm very happy it took me to where I am now.
So you know Nick Shed?
I do.
Good guy. All right.
Yeah.
So what was it like transitioning from the Astros to the Twins? Any major hiccups, or did it just kind of feel natural, like, okay, this is a great organization, I'm going with it?
Yeah, it just was a natural transition. I think everyone has their niches in different places. And I felt like with the Twins, I fit right into that. And it was really they agreed with my philosophy on things. I agreed with theirs. Like, it was a very smooth transition over.
Okay. What's your philosophy?
I'm still in the works as being a young athletic trainer. Developing.
As it should be. It should be something that you're molding right now. So all the better. But what's the bedrock?
I like a very holistic approach. Obviously, I have experience in multiple different fields that play into athletics and sports, like sports psychology. I have somewhat of a background in the strength training side of things, just based off experience. I was an athlete myself, and the athletic training side, obviously. But I think a holistic approach of everything and everyone in every department needs to be involved in an athlete's, whether it be return to play, rehab, performance, development. It should be a very collaborative family, basically, in my opinion, and then go from there. Obviously, each realm has its own specific philosophies, but mine overall, everyone needs to be a part of it, and everyone needs to collaborate to help get that athlete to that peak performance of where they need to be.
And then that probably holds true within your own discipline of athletic training, where prior, maybe for a generation prior to you and several before that, the approach was very isolated, very symptom centric. You got something with your rotator cuff, it has nothing to do with hip rotation or the ability of your knee to flex properly or anything like that, which is something we talk about these days. But prior to that, it was, hey, we're just going to give you these typical standard rotator cuff exercises. You're going to throw some ice on it. We might do some muscle stim, and I might get in there some soft tissue. But I'm imagining your approach is also holistic. Would that be accurate?
Correct. Yeah, it's very individualized based on the player too. I think, like you said, like before it was very like local based. Like, oh, we're gonna treat the symptoms. We're gonna do stim. We're gonna do an ice bag. We're gonna give you a couple exercises for specifically just your rotator cuff, for example. But I think one of the few things I've learned over the last couple of years, like you were just saying, is to look very global. And there's so many more pieces that factor into just your shoulder or your arm. It goes down the chain all the way down to your foot on the contralateral side. Like, it's the whole chain is involved. Now, again, it depends on the player. I think there's certain injuries, there's certain things we treat local first. And then if it's not getting quite what we need, we look more global. Because sometimes I think if we look too global, it can cause more of an issue than anything. But I think, again, it's very individualized based on the player, based on what they present with, based on what they have going on, how they move based on like assessment wise. There's so many factors that go into it.
And you mentioned that when you're doing like internships or in grad years, you're really exposed to baseball being the place where you first did kind of residency. Is that what got you to stay along the path of baseball, or was it just the happenstance of COVID? I mean, do you know what I'm saying? Like, if the NFL or the NBA or MLS came knocking, or the women's soccer, whatever it is, are you just not to put you on the spot here, but do you just love baseball?
I absolutely love baseball. I've had a passion for it since I was younger. Me and my dad grew up watching it. A lot of my buddies growing up played, so I was around it all the time. And it kind of reminds me of like an underdog sport. People kind of underestimate baseball and how hard and difficult it is. They underestimate the type of athlete baseball players actually are. Like I know growing up, people are always like, "Oh, baseball's easy. Oh, baseball players aren't that big of an athlete. Like it's not that hard." You guys try hitting a little ball with a stick at 100 miles an hour. Like, so, and then on top of that, you add in like the injury side. Like they're just so much more complex when you take a rotational athlete or a multi-plane athlete and factor in the injuries that come with it. You know, I've seen some crazy injuries that I never thought I would see with baseball players. So I think just the sole like challenge honestly has kept me going. Plus the love of the game. It's fun, the camaraderie, the shit talking, the environment. It's just always a good time for me because that fits my personality. I'll be honest, I'm a shit talker. That's how it is. But it just is like, it kept it going. It's never boring. There's always something new to learn. And it wasn't a sport I necessarily played because softball is different. Like I played softball, but to me, they're two different sports. So like also being the sole fact of I didn't play it kind of kept my interest a little more because it was more of a challenge for me to learn the mechanics, learn the environment and all of that comes with it.
Well, we're going to take a little break in the action right now to tell you about a course that I'll be teaching at the Perform Better Functional Training Institute this January 21st, 2023. It's all about anatomy and motion, understanding what happens when the foot strikes the ground all the way through the chain, at least for the lower body closed chain biomechanics. And this is a game changer. Once you understand how joints move, then you can get a better understanding of how muscles react to those joint motions. And when it comes to program design for athletic trainers, physical therapists, strength coaches, and the like, even manual therapists, this is information you want to know. So you can go to rockysnyder.com and check in with courses and workshops. Click there and it'll lead you where you can register for this one-day event. Again, Perform Better in West Warwick, Rhode Island. Hope to see you there. So I got to ask, East Bay, you're growing up in San Francisco area. Does that mean A's over Giants or what?
So you're going to lose your mind.
Red Sox fan.
The Giants, I am a Red Sox fan.
Yeah, girl. Oh, I knew we were going to hit it off. I love that. Right over my shoulder right here, for those that aren't watching the video, that is Fred Lynn in the 1975 World Series against the Cincinnati Reds. Of course, I'm not going to tell you my age at the time, but that was the first heartbreak of a baseball Red Sox fan. It wasn't until 2004, of course, that we redeemed ourselves. But good for you, Red Sox. Why?
My dad is actually from Massachusetts. So like I didn't really have a choice. Like, you know, New England families are like, you're a Patriots, Red Sox fan. You don't have enough.
Straight.
So I was
Unless
like,
you live in Connecticut and then you're all screwed up, but we won't get there.
Then you're like in between. Like you have to
you're not even part of us.
Correct. But like Bay Area team, like because I'm from California, I'd say Giants for sure.
All right, whatever. Well, that's almost like an asterisk in this conversation. But the main point here is that you're a Red Sox fan. Fantastic.
Correct.
So, well, yeah, that would be great. So that actually brings a good kind of topic here. You know, we're talking like Moneyball. Of course, we're talking about the Oakland A's, and then Billy had a chance of going to the Red Sox, but at least they took on that idea, the strategy that he had. And of course, 2004, they win the World Series. If anybody hasn't seen the film Moneyball, it's pretty good. But there's a discrepancy. There is an unevenness in a lot of sports teams where there's some really very rich owners, and then there are those teams that are owned by the township or the city, or maybe by those that don't have big purse strings. And when we compare, say, Minnesota Twins organization to the juggernauts of the Yankees, the Red Sox, the Dodgers, right? There's this discrepancy there. How does that filter down into your world of athletic training and rehab?
And honestly, like I can't speak a lot to that because one, I don't like totally knowing all of that. Like I said, still young, still just trying to get my foot in the door. Like my focus is where I'm at, and I like to stay very present in that. I mean, I know every organization is different, so I'm sure that it factors down into the levels and different parts of the organization. But I honestly can't speak to exactly how it would affect anything.
No problem. But okay, so how about this? We're just finishing up the World Series here, and your team, unfortunately, not or our team, however you want to say it, Twins, Red Sox, they're on vacation right now. It's off season. So what's your role? What is your role right now with the Twins organization in the off season?
So I was one of the athletic trainers down in the FCL, so rookie ball, this year. So I was down in Fort Myers in the complex league pretty much the whole season. But right now, we pretty much are doing check-ins. We check in with the players. We give them off-season programming for like maintenance programs if they need it. Just check on, see how their lifting programs are going, see how their like throwing programs are going. And if there are guys that are on like a more intense or like needed maintenance program, we follow up a little more heavily with them. So right now it's not like downtime because people are like, oh, it's baseball has an off season. Baseball never has an off season. It's just slower. There's no off season, which is okay with me because I get bored. So I need to be doing something at all times. But
so does that mean you're learning stuff now? Like I'm sure you're always trying to find more information and grow your career and your knowledge base, but where is your attention when it comes to that? Like if you've got a little bit of downtime, what are you learning?
So sometimes I'll pick up some of like psychological books, like self-type health books, kind of more sport specific, whether it be like autobiographies on players in the past that have dealt with things or injuries and how they overcame them, stuff like that. Right now, I'm about to get into more of like a movement assessment course. One thing I learned this year that I kind of got a little more exposed to was like FMS and SFMA. I learned FMS a couple years ago, but wasn't using it as heavily as I was now to like actually like kind of guide rehab programs or maintenance programs and really help use it as an assessment tool to program for these guys. So, but one thing I feel like sometimes those don't give us is that rotational aspect, because I know my thought now is I want to do TPI. I'm sure you've heard of it, like old school on base U assessment.
Yeah, quite familiar with it. In fact, it's in your old neck of the woods that I was doing TPI, Oceanside. So
Really?
that's where Titleist Performance Institute is. And
Okay.
so I went through level 1 and 2 and with Greg and Dave and Tom House, actually. Tom is a former Major League Baseball pitcher, but he was with TPI for a while. Now he's quarterback coach for Tom Brady and a whole bunch of other NFL quarterbacks. Crazy, isn't it?
That's
Yeah, but TPI's got some good stuff.
So that's kind of my next route. I kind of wanted something a little different than what the rest of our staff had. So that's my next course of action for the off season, is diving into that course to help bring it back to the Twins next year.
Nice. Yeah, that's beautiful. And so when it comes to the athletes that you mentioned in terms of the self-help or the psych books, that how do they overcome adversity? Any particular athletes that you've been hunting down right now, like in the past? Jackie
Not,
Robinson.
not specifically. Sometimes it's only if I like I'll come across a book. I had one, I forget what his name was, but it was a pitcher overcoming like the yips. I forget what the name was. I have the book here, but basically just stuff like that. Like, cause I know it's not necessarily in my realm as an athletic trainer, but we do see these guys probably the most out of anyone, right? Out at games, in the training room, out on the field, at practice, like we are there constantly. So just basically even understanding kind of where their mindset is helpful. Just even getting to know players and like building those relationships and building those that trust and that bond, just to have those conversations in the instance that they do get hurt. So like to me, like creating that foundation is really important, because in the time that they do get hurt or they do need something, they feel comfortable coming to us and be like, hey, Katie, I need this, or hey, like this is going on, this is bothering me. Versus, like I said before, like I was this athlete, I don't say anything, I'm stubborn, I want to play through it, right? And that could end up leading to more severe injuries, more severe issues later on down the road for them.
Sure. Now, I know everyone is individual, and how a person moves is just like fingerprints, where everyone has their own unique patterns. However, there's going to be athletes that you're dealing with that have recurring issues. How do you deal with that from a physical standpoint? Like you and your crew with other ATs or the physical therapists and the strength coaches and maybe mental skills coach, whoever you have on that make up your team. How do you deal with those athletes, you specifically in what you're doing, and then maybe collectively with the team and psychologically as well?
Yeah, I think those chronic injuries are difficult. I think mentally for an athlete, especially, they can be very frustrating because they reoccur. You fix the problem once and then it happens again. You fix it again. And then I think a big piece of those is the timing of when you fix those. I think a lot of times the time that chronic injuries appear, it's not like the most ideal time. Kind of like what I learned when I was that performance specialist, like that off season is like that crucial point, right? You have the time where you're not playing 100 and something games, you're not changing mechanics, you're not doing all this stuff where your body's just on overload and overdrive all the time. You have the time where it's calm, it has the time to build those mechanical adaptations that it might need to create and like sustain whatever it needs to sustain. I think in season dealing with those, it's really just about working with the player on my aspect, really having that open communication, really making sure they're telling me exactly how they're feeling, whether it be physically or mentally, right? Frustrated, not frustrated, just done, over it, like whatever they're feeling, just making sure that line of communication is really open and just explaining to them like my thought process. Like my theories and philosophies, just be as open with them as I can, right? Like if they have a question, I'm going to answer it, right? Or I'm going to explain it the best way I can explain it to them, right? I'm not going to sit there and hide something from them. I feel like if that communication is open, then they'll be like, okay, like let's keep working on it. Let's, it gets them to keep buying into what we're doing, even if it's a slow process. Because some injuries, some chronic injuries, they don't get fixed like this. It could be months, right? It could take a long time, and it could be very small, minimal progressions that might not be very noticeable to the athlete. We might notice it as like the medical professionals or S&C coach or sports psychologist, but as an athlete, they might not notice those tiny little differences because they've dealt with something for so long. But I think that's when everyone comes in, like you said, assessments based on if like one person assesses something and they're like, okay, this is what I got. I think having and bouncing ideas off of everyone, like, okay, maybe a PT can look at them as well. Maybe we missed something that maybe they have more experience in, or if S&C does an assessment that's different than our assessment, maybe they find something that someone had missed. So I think playing off of each other's strengths is ideal, especially in those like chronic injuries, because someone might have more experience in one thing, someone might look at something differently or have a different perspective on something and might notice something a little different than someone else. So having that collaboration, again, it goes back to that, and that open communication among your entire staff. I think in a situation like that, where it may be one of those instances where it's kind of an up and down injury, until you can all come up with a solution. And like I said, being open with the athlete and being like, hey, this is a very long process. This is not going to take a week or 2 weeks. And just being pretty straight up with them of like, this could take up to this amount of time. And then they're like, okay, like patience, like maybe I can, keep working, and just kind of being with them through the whole thing. Basically, like you're that support system that they need.
Makes sense. Okay. Anecdotally, if you can think back about all the athletes, whether it's from your college years all the way to where you are now, uh, pull out one without naming names too, by the way. I don't really like talking about players specifically, but just like a case study where this person had, whether acute, chronic, recurring, whatever the injury was, they were not playing, and you helped get them back and just light them up to where they're back to play and they're just excelling. You've got to have a story like that.
I feel like I do, and I have such a bad memory sometimes that I feel like it takes me a while to think of those things.
That's because of your time at Chico State, obviously, but there must be.
Careful. Let's see. I feel like I don't have one specific one. I think because for me, the thing I remember the most, like, is the process and how we got to that point. But the sole fact of seeing the athlete back on the field, and basically you can almost like feel their emotions when they get back on the pitch, back on the mound, back behind the plate, whatever it may be, like feeling that emotion of when they step back on the field, like, is probably one of the most rewarding things I think in my life. I don't even know how to describe it, to be honest, but I've definitely had many times with different athletes, whether it have been during my undergrad years, whether it was in grad school, but they're also different. And honestly, they were not easy processes. A lot of them were tough. Like, it was a grind but it's like, okay, this is difficult, but we're going to grind through this together. We're going to get through this no matter what. We're going to work together. We're a team. We're going to get you through this. So, like, they were never easy, like, oh, this is smooth sailing, like everything's working perfectly. There was ups and downs. There was twists and turns, kind of like how you said in San Diego, where it feels like you're going in a loop-de-loop in a triangle in 60 million different directions. I feel like that's how rehab can be sometimes with some of these injuries. And then you factor in the mental aspect too. And if you're not mentally on board, the physical aspect can suffer as well, because if they're not focused, if their attention isn't there, physically, they're not going to want to do what they need to do. They might half-ass it. They might not have attention to detail. So again, it goes hand in hand to me. And I think basically bringing it back to, like, my thing is always day by day. We're always going to focus on everything, take it day by day. Okay, what did you do today? How well did you do? Perfect. Move on to the next day. Don't look too far forward. Don't look too far behind. Because if you dwell on the past, you're not going to move forward. If you look too far in the future, you're not going to focus on what you have to do in the present. So that's how I kind of help get my athletes to go and approach injuries and rehab.
Oh, it makes sense. What about different methodologies or tools? For instance, like dry needling has infused itself into Major League Baseball and several teams I'm aware of. Cupping, these traditional Chinese medicine approaches that have become Americanized, or maybe it's wearable tech that somehow gives you better insight into working with an athlete. Are you using anything like that, or are you intrigued by some of these approaches and starting to look into them?
Yeah, the wearable tech I'm not super familiar with. I'd be very interested in it, but I don't know a ton about it. At this point, we don't use a ton of it, so that's not something I've been exposed to a lot. Dry needling, I wish ATs could do it in Florida, but we can't. That is something I would definitely be interested in. I've seen it work. Our PTs do it, and I've seen it work wonders, especially when you couple it with exercises and retraining the muscle after they've done it, the dry needling. So I wish, like I said, we could do it here, but we can't. I'm honestly very old school. My hands is what I like to use. I like tools. I like Graston like instrument assisted soft tissue. I like cupping for different
ART, MAT,
correct.
Yeah.
But like basic myofascial, like soft tissue is kind of my game, because I feel like I can actually feel the tissue. I can feel the difference in the tissue after I've worked on a player. So that gives me a gauge on like range of motion. It gives me a gauge on how that tissue is moving. Is it sticky? Is it toned up? Does it glide well? Like, I feel like for me, I can get a better feel of it with my hands. than I can with some of like the tools that we get exposed to. But that's just me. I like using the other stuff. I will use it if I find it necessary for whatever the injury is, but I'm a big old school, like I'll just use my hands.
And what about percussion, like massage guns, those type of things? Not too much?
Not so much. Like I know the guys, we have them and the guys like to use them. Again, I feel like I can't feel what I'm doing with a massage gun, or a guy can't necessarily feel, right? So a guy will sit there for way too long and he's like, oh, I'm sore. Well, I mean, yep, you just sat there with the massage gun on your quad for like 6 to 8 minutes. Like, I don't doubt it. So I think that's the only thing I don't like about it is I just can't actually feel what I'm doing. So there's no like that tactile, like that sense of touch with it.
And how far do you follow the rabbit down the hole? And what I mean by that is like you're on with, you got some tissue, but that's connected to this fascial line, whether we want to bring Tom Meyer's anatomy trains kind of consideration into it, but or sling effect. You know, we've got all these connective pathways. How, like, do you just use instinct to say, okay, I'm stopping here, or do you just go, oh, well, maybe this guy really, actually, I'm coming on to something. Let's just continue this all the way through. Oh my gosh, his serratus is so locked up. No wonder that shoulder wasn't going to move, and that elbow's tweaking. Like, how deep do you go?
It depends. I like to go down the rabbit holes, so there will be times, like you said, I will follow those fascial slings and will maybe not go all the way down, but I'll go a bit down the road with them because you're right. It's all connected, you know? So I'm going to start local. The guy says, oh, I feel restriction here, here, and here. This is bothering me. Okay. We're going to attack the serratus. We're going to attack the posterior cuff. We're going to attack your upper trap. See if that local area loosens everything up. If not, we're going to go a little further. But I think instinct also comes with it too, and just knowing my athletes, knowing how they move, watching their throwing mechanics, watching their movement mechanics and anything that they do. And like I said, that kind of instinct / sense of touch. It's like, okay, I feel that kind of loosened up. Okay, let's keep going a little bit because I still feel some sort of restriction, and kind of base it off of that. It's so I will go down the rabbit hole. I will go that entire fascial sling if I need to. Especially also based off of whatever they're presenting with. But yeah, I kind of based off instinct, and whatever I'm kind of feeling, I'll let my thoughts kind of just go with it.
Okay, most common injury right now that you've been dealing with this past season?
Ooh, most common this past season, we had hamstrings, strains, and then shoulder impingement is probably one of the most common in baseball that you'll see. But hamstrings were, I don't want to say they're fun, but they're kind of fun because there's not a whole lot of research on hamstring rehabs in baseball. So
really,
no.
You would, okay. What the heck's that all about? Shut the front door, because I'm thinking that's probably, it's one of the most common high hamstring pulls. We're also maybe inversion sprains, low back, rotator cuff, right? So and then we get into the elbow because of overusage. But what the fire is that all about?
I don't know. It's something that I've been kind of interested in the last couple of years because I've had a lot of baseball players that have that high proximal hamstring strain. Baseball is a very anterior sport. I think the posterior chain gets forgotten about sometimes. And it's just solely based off the sport. Like it has nothing to do with, you know, the training necessarily. It's like they're using that anterior side so much all the time that like the posterior side kind of shuts off almost in a sense. And I just think we don't think of baseball as like a high speed running sport because you're not a soccer player. You're not sprinting down the field at 50 yards, right? Or running across the football field to score a touchdown in the end zone. So like, it's not looked at as that like high velocity, max velocity sport.
No, but you do have explosive acceleration, deceleration in a very short amount of time.
Correct. So I think I don't know how like why there's no research. I've honestly been trying to figure that out myself. Because all the research you find on like rehabbing hamstring strains is like rugby or soccer or football. Like there's none on baseball. And like even with baseball, it's like you said, it's a very quick explosive to a quick decel, but also with the change of direction that you have to factor into that. It's very reactive, right? It's not like necessarily like, oh, here's my route. It's I have to change direction really quick, really fast, and then slow down and maybe go the other direction.
I would think if you looked into sprinters, like 400-meter, 800-meter sprinters, Olympic level, you'd probably find something there. Just because change of direction, and usually it's just coming out of the turn toward the straightaway that hamstring pulls occur because of all that force vector coming around the corner, which is infinite numbers until you get to the straightaway. I don't know. I'm thinking about geeking out with you right now because I'm just like, we're talking about basically gait mechanics. So if you can do a breakdown of what their gait mechanics are, you're probably going to find one of the underlying culprits.
Correct. And riddle me this. This might be an interesting topic for you.
Let's do it.
I think this is my thought process on hamstrings too, as well as with baseball, you have different sports, like different positions. So on top of that, I think you also need to train the hamstrings in different ways as well, because a pitcher versus a shortstop versus an outfielder, the stress and load on the hamstrings is going to be completely different.
Huge.
And a catcher even completely different.
Yeah, so, I would agree. Catcher, pitcher, and any of the field.
Yep. And so thinking about how also like then you have to factor in that aspect of like when you either are training in like a S&C setting or even on a rehab setting with a hamstring strain, right? On that return to play aspect, it's like, okay, well, their running progression needs to kind of simulate what they're doing in their position. Or when you have guys that go from a catcher to an outfielder, then you're in another pickle. Because you have a guy in a catching position who his hamstrings are shortened the entire time. Then you have a guy in the outfield who he's getting in that max speed, that max velocity almost phase of running, right? And they're lengthened out a lot longer. So then it's like, okay, how are you training that? How are you balancing that one?
So I think one of the problems is how we look at hamstring contraction. From basically how we've been known to look at it is through an open chain behavior. When the hamstring shortens, it's going to extend the hip, posteriorly tilt the pelvis, and flex the knee. But it actually, as soon as you put the foot on the ground, everything changes. I mean, the hamstring, because it crosses in multiple joints, is going to behave different proximally than it will distally. For instance, when you step off the mound and you go to pitch that lead leg, the knee is going to flex. So you would expect the hamstring to shorten, at least distally behind the knee. But the pelvis is anteriorly tilting and the hip is flexing on that forward leg. So therefore, we've got proximal lengthening. So we've got one end of the hamstring lengthening while the other one's shortening. And yet, how many people really train the muscles to do that? And I think the misbehavior and the lack of proper training based on functional anatomy is where we're getting into trouble with high hamstring. And then to put a little bit deeper layer on top of that, if we look down at foot mechanics, we would find that the calcaneus, the heel bone, is going to move identically in all three planes of motion as the pelvis. So, and they're meant to be coupled with each other neurologically and biomechanically. So therefore, if I've got a lack of proper dorsiflexion, plantar flexion, inversion, eversion, internal rotation, external rotation of that heel, I'm going to probably have some kind of issue higher up the chain.
Correct.
How about that?
I agree with you completely.
That'd be pretty cool.
Yeah,
we could totally geek out on this.
Oh yeah, I did some research when I was in grad school because we had a lot of soccer players with high hamstring strains as well, and I was like, there's something I'm missing. Like, what am I doing? Like, so I started looking at the feet and the ankle, and when they have that lack of dorsiflexion, it put added stress on the hamstrings when they were decelerating. So I was like, oh, that makes way more sense. So it's like, again, it goes back to like everything's connected.
Everything's
involved. So I think that's kind of like with my approach with hamstrings now is like, I just don't look at a hamstring because we were always taught like, oh, look local for a hamstring, treat the hamstring, right? But like you said, the hamstring crosses two different joints, right? So in reality, you really need to look at the entire leg and more.
Yeah, where does the hip start and where does it stop? I mean, if the hip is made up of the femur and the pelvis, well, the femur is not just the top level, the top half of the femur, and it goes all the way down and it turns into a knee. So really the knee is the lower hip,
Yeah.
right? I mean, if you want to consider it that way, but then yeah, it's all connected. So where I am missing movement in one place, I have to make up for it somewhere else. Could that hamstring be having to go beyond its normal length to make up for somewhere else that is not moving, potentially the ankle? It could be extension of the spine. Maybe this person doesn't extend the spine well. So then we're going to have to get that pelvis to tilt even more forward. I mean, it's just, that's why you're going with like SFMA, joint by joint assessments, finding out how those move. Fabulous. So you just start to get a bigger picture when you put all the pieces of the puzzle, kind of connect them together and look at each puzzle as it is. Okay, Katie, we could totally geek out for another hour, but I don't want to take all your time. I do want to know this though. Where you are now is where you're happy, but you've got goals and ambitions. So I could see that there could be and I guess we got to talk about the elephant in the room. Currently, you're a female, right? Am I judging that correctly?
I think so. Yeah.
Okay, that's good. So you don't find a lot of female athletic trainers, although there are some, and I've had conversations with several in the world of professional sports. Head athletic trainer of a Major League Baseball team, is that potentially a goal that you have?
It is. That has been something that I would love to accomplish. I saw Sue Falsoni one time and I met her at a conference and was like, wow, like I would love to be at that level that she was able to get to. And it's not even for me. Like I've had a goal to get there, but I want to be able to really impact these players and these guys and bring what I have to the table to help make their careers, their lives, everything else better. So I think that's more of why. But yes, that is eventually a goal that I am striving and working for.
Right on. Yeah, Sue is wonderful. And for those in the listening audience, Sue Falsoni, she was the first female athletic trainer in Major League Baseball, worked with the Los Angeles Dodgers. And actually, a previous episode, if you go into our archives, you can get a conversation with Sue and myself. So she's wonderful. But Katie, this has been great. I really appreciate your time. This has been super fun. And I have a feeling our paths are going to cross again in the future. Just the way that you're heading and everything that you're looking for, it's going to be really cool to watch your career path blossom because it just seems to be going everything in the right direction. So thanks for coming on.
Yeah, thank you, Rocky, for having me. It's been awesome.
And that's a wrap for the Zealous podcast this week. And I want to thank Katie and the Minnesota Twins organization for allowing her to come on and have such a great conversation. In fact, I might just click the rewind button and listen again because she has some great insight. In the meantime, you can catch us every Monday morning, 9 a.m. Eastern, 6 a.m. Pacific, for a new episode when we talk to the pros behind the pros. Until then, be sure to follow us on Instagram at Rocky_Snyder. Hit the subscribe button, and we'll see you next week.